Everybody, it's 3 o'clock. I like to start on time, even though I'm sort of an on-time kind of girl, just getting here moments before the meeting starts. So I want to call this meeting of the Older Adult Advisory Committee together, and the first order of the agenda is the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Adriana, can I have you call the roll, please?
Betty Bishop. Rochelle Fuquay. Here. Jennifer Hamill. Here. Nils Umholt.
Here.
Suzanne Ostosh. Vito Pianello.
Here.
Phil Randazzo. Marcia Relier. Here. Joe Silbernagel. Moira Smith.
Here.
Carol Thompson. Barbara Vansickle.
Here.
Carol Weidenbach. Kathy Western. Here. Roy Wilson. Carol Weisman. Here. That completes the roll.
Thank you. Next up is the adoption of the agenda. I hope you've all had a chance to look at it, and I would accept a motion to adopt as printed.
I'll make a motion.
I didn't see who all did this, sorry. Vito?
Yes.
And Kathy? Okay, great. Any discussion? If not, all those in favor of adopting the agenda, please say yes. Yes. Any opposed? All right. Next up is the approval of the minutes dated June 28th. Hope you've had a chance to read those. And I would entertain a motion. Barbara and Marcia. Any discussion of the minutes, corrections? If not, all those in favor of approving the minutes as printed, say aye.
Aye.
Any opposed? All right. Item number 6 on the agenda is public participation. The first opportunity for public participation is for those who wish to speak for a maximum of 3 minutes on any item on today's agenda. The second opportunity for public participation is for those who wish to speak on any issue. Anyone wishing to speak in public participation? Anyone wishing to speak? Anyone wishing to speak? All right, that closes the first round of public participation. Next, we have 2 presentations this month. We're catching up on our long list of things people wanted to hear about. So the first presentation is going to be from PACE of Southeast Michigan, Callie Miller.
Hi, and yes, I'm Kaylee Miller, Community Outreach with PACE Southeast Michigan. And I'd like to start with a video first from our CEO and medical director.
And what we provide is all the clinical care and all of the support services that are needed to allow somebody to stay in their home. I think staying in the home is important to people because it's what they've known, right? We all seek home. It's what we know, it's where we feel comfortable, it's where we feel safe, it's where we have predictable routine, and we know where our furniture is at, and we know where our food is, and so when you can keep somebody there, their life feels more secure.
First of all, I think it's important to understand that many of the people that come to PACE have many needs, and for many of them, they are needs that have been unmet for a number of reasons, because they didn't have the insurance coverage, they didn't have a way to get to the physician. But when they come to PACE, what we're able to do is to provide them a comprehensive plan of care. So whatever the needs are, we are able to manage, monitor, and make certain that those are fulfilled.
There are no out-of-pocket expenses for them because we are the health plan. We are the insurer. And we provide all their medical care, we provide all their prescriptions, we provide their home care needs, we provide all their rehab services, we bring them into our center, we provide the transportation that's needed.
To be able to say, I need to go to the doctor and I'm not worried that I'm not going to be able to afford this. I need to go to the emergency room. I'm sick. It's like, this is all taken care of. And when you have that peace, you're able to get well.
When we can provide additional support, whether it's home care or doing some housekeeping, making certain that it's safe there, that they can get in and out of the house without any safety hazard or fall or trip hazard, it makes a huge difference.
In addition to that, we have day centers, and in those centers we have clinic urgent care. We have a day room where there's recreational types of activities to keep them socially interacting with others, as well as stimulating their cognitive abilities.
They started working with me, like getting me another place. They talked to me and told me this alcohol is not necessary. I come in, I talk to them, have a little fun, and eventually I wasn't doing no more.
And I'm relatively healthy now because PACE. It's really enhancing my life.
So I think that's a great introduction from the CEO and Medical Director for PACE. PACE is a national program. It's been around for over 25 years. It started in California, and there's over 130 PACE programs nationwide. PACE stands for Program of All-Inclusive Care, and truly the whole goal of this program is to help older adults, 55 and older, stay living in the community safely with the support of the PACE program. People that are eligible have to meet all of these criteria. So as I suggested, we work with people 55 and older. They have to have what's called a nursing home level of care, but we look at chronic medical concerns like people that might be on oxygen or dialysis, people with cognitive issues where they may have difficulty making good decisions or have some memory loss, or people that need assistance with activities of daily living. And we can look at toileting, transferring, and feeding. So it can be as simple as I'm sitting in this chair next to me and I can't stand up by myself every single time. I need to hold on to my walker, I need to push off the counter, where someone needs assistance at least 3 times a week. They live in our service area. We now service all of Macomb County, most of Wayne, and most of Oakland. And what we don't cover is covered by one of the other PACE programs. There's PACE Huron Valley and PACE Genesee County. And people need to be considered safe in the community with the support of PACE. So as we're coming in and providing supportive services, and in order to determine that when someone's intrigued to learn more about the program, we send a nurse and social worker to their home to make sure that with our support and whatever we can do to help them, they would be considered safe. PACE has lots of different services. So we help people in the home. We can help with laundry, housekeeping, personal care, bathing, dressing, grooming. We have a day center. Actually, we have 6, soon to be 7 centers. The 2 in Macomb County would be in Sterling Heights and East Point, but we're also located in Detroit, Dearborn, Southfield, Pontiac, and we're opening another center in Western Detroit probably next month. So at these centers, we have all kinds of programs, activities, field trips, entertainers that come in. We serve them nice meals, breakfast, lunch, and snacks. We have a rehab gym so people can work with physical and occupational therapy. Because we want them to be independent and active, we encourage them to do therapy as often as they want for the rest of their lives. We also send our therapists to people's homes when they first enroll to make sure they have everything they need. So would they benefit from a shower chair, a lift chair, grab bars? We provide them with all of that equipment when they're first enrolling into the program. And then we have a full doctor's office right on site. We are owned by the Henry Ford Health System, and we coordinate all of their medical care through Henry Ford. So we become their doctor, we coordinate making sure they see their specialists, and if they need assistance, we do partner with families to provide transportation to medical appointments as well as to our center. We deliver medications to the door. We give people all of their medical supplies. So if they need incontinence supplies, equipment, Motrin, Band-Aids, anything deemed necessary medically, we will provide to the people that are in the program. So there's a full interdisciplinary team that meets on a regular basis. We have physicians, social workers, dietitians. You can see the whole list of professionals here that are working together and collaborating to make sure that people are getting what they need in services. So we may have home care people that are in the home that notice subtle changes with people's conditions that they can bring back to the team, they can discuss, and then put a plan together for those individuals. So most people are like, okay, well, how is this paid for? It's paid for by Medicare and Medicaid. As long as someone meets the Medicaid criteria, there would be no cost to be in the program. If they don't meet Medicaid criteria, then they could pay privately, and it differs per county. It's about $5,000 a month in Macomb County. Because we are the provider of care, we take on all financial risk, and we're their insurance company as well. Medicaid criteria for an individual is they would need to make less than $2,523 per month and have less than $2,000 in liquidable assets. And as long as they provide us with those documents, even if someone doesn't have Medicaid, we have our own Medicaid workers right in our office, and we can apply for people for Medicaid and get that coordinated for them. So people that are referred to us are people finishing with home care services that once their skilled home care ends, they would benefit from continued care. We work very closely with hospital and rehab social workers as they're discharging people home, or anyone that knows someone that would benefit from services that want to remain living in the community. So when someone is referred to PACE, we do a home assessment to make sure that they qualify, where they can continue to learn more about services. So typically someone would call a liaison like myself, and we would explain the program, and if they're intrigued to learn more or to see if they would benefit and qualify for the program, then we send the nurse and social worker out. We can also bring people into the center so that they can meet the doctor, meet the staff, see what the program is all about. It helps people when they can visually understand more about what we do. And then we take on the rest of the whole enrollment piece. So if they say, yep, I'm interested in PACE, we can coordinate with the insurance companies and the Medicaid and get everything together for them. I also have a video that we're going to show that shows what the Day Health Center looks like more specifically. Now this is our Pontiac Center right before it was opening. And of course with COVID we were very careful bringing people into the center. So in these videos you're not going to see a lot of people in the tour, but know now that we have hundreds of people coming to the center on a regular basis. So thank you.
Welcome to PACE Southeast Michigan. PACE stands for the Program of All-Inclusive Care for the Elderly. Our goal is to help seniors live safely and independently in their homes and communities while providing for their medical, physical, and social needs. While PACE is a highly respected national program, everything we do at PACE Southeast Michigan is local and individually focused on the health and well-being of each participant. From the moment a person arrives at one of our PACE Southeast Michigan locations, they will feel a warm welcome that lasts all day. During the COVID-19 pandemic, that warm welcome still happens, but often in other ways to keep our participants safe, through home visits, phone check-ins, medication and meal delivery, video visits, and more. We welcome our participants to a PACE Southeast Michigan location, or we extend that care into our participants' homes, where we provide housekeeping, laundry services, personal care services, and much more. In fact, as they open their doors to us, our participants are still completely in our care. Even at home, they are still all under the protective roof of PACE Southeast Michigan. In non-COVID times, this place is bustling with activity. The Day Health Center is where our participants enjoy good food and great conversation with staff and fellow participants. It's a cheerful place where the sun always shines. So come on in and sit for a while, but don't get too settled. Bingo, brain teasers, crafts, and even field trips await. The rehab gym is where the action is. Here, participants get both physical and occupational therapy to gain strength and healthy habits to keep moving. There's no limit on therapy sessions, and our therapists work one-on-one with each participant to understand their unique physical needs. Our participants see their primary care provider, nurses, and other members of their health team in our fully staffed health clinic, with transportation to specialists as needed. In addition to doctors and nurses, the PACE Southeast Michigan interdisciplinary team includes social workers and other mental health professionals, therapists, dietitians, pharmacists, and transportation professionals. We provide all clinical services along with dental, podiatry, vision, and audiology. PACE Southeast Michigan always puts our participants first, whether at one of our 6 sites or at home during the pandemic. Each PACE Southeast Michigan participant can rest assured we will provide the very best opportunity to continue to live with dignity in their own home for as long as possible, surrounded by everything and everyone they love. That's our promise. PACE Southeast Michigan lifts any worries of a caregiver in the days their loved ones is at PACE and even at home. PACE Southeast Michigan professionals are available 24 hours a day, 7 days a week, and on weekends and holidays too. It's all under the protective roof of PACE Southeast Michigan. Just call 855-445-4554.
For if anyone has any thoughts or questions for me today.
Question? Marcia?
I have a question.
Okay. Are there some people in the PACE program that do not attend the centers and they're only home care?
Yes, they only have to come to the center twice a year to see the doctor.
Wow.
Otherwise, we can provide all of the services, transportation. It is not mandatory that they come and see the center on a regular basis. Good question, thank you.
Yeah, because I can't imagine not going to the center, but I wonder for some people that would not be an option.
Some people will choose to come once or twice a week. Sometimes they want to come once a month, but they do come twice a year to see the doctor.
And another question is, I would think people would be, pounding down your doors to get in. So what might be some of the reasons why either people choose not PACE or PACE disqualifies them?
Probably one of the biggest reasons that people hesitate on joining is the physician piece. Because one of the requirements is we do become the primary care doctor. We can contract with some physicians where they can see them twice a year for like a meet and greet, but truly we do coordinate all of their medical care. But it was kind of funny because one time I was talking to a lady about the program. We were having an event at our center, and she said to me when we first started, she's like, listen, lady, I'm not joining your program. I'm here for your free lunch because my friend made me come with her. I've had the same doctor for 30 years, and I would never switch. But after the event, she called me over, and she's like, holy crap, where do I sign up? She said, I told you I love my doctor, but he doesn't feed me, do my laundry, do my housekeeping, provide transportation. So that's probably one of the biggest reasons. Or if someone does not qualify for Medicaid and they don't want to pay privately. Or we talk to people too where sometimes they're really interested in being in the program, but they don't need that nursing home level of care. So there's several reasons, but we do ask that people be good stewards and tell people about the program because we are a nonprofit. We don't do a lot of advertising. It's all pretty much word of mouth for when people learn about the program.
Hi.
Hi.
Could you compare and contrast what PACE does compared to the My Choice waiver program? And when might a person be slotted to one or the other?
So we are also a waiver program, being that we are paid for by Medicare and Medicaid. We are more of a collaboration of care in the health insurance where we become their doctor, the nurse and social worker are their resources, and we help to manage that care in the home. My Choice Waiver is another entity that some people may choose, but with this it's more of a collaboration of care and continuation of care in the home.
So if I'm the referral agent, when do I say you should be going toward My Choice waiver versus PACE?
Well, I can tell you with PACE, if you know someone that is looking to stay in the home, they are needing any type of service, that would be the type of individual that we would be working with. I don't know as much about My Choice Waiver, but I can definitely get more information for you and follow up at a later time. You're welcome.
Carol?
You mentioned your funding, the medical part is from Henry Ford?
So we are paid for by Medicare and Medicaid.
Oh, okay.
But we are sponsored by Henry Ford and Presbyterian Villages of Michigan. So all of our care coordination is through the Henry Ford Health System.
Okay, and so then Henry Ford is paid by Medicare, Medicaid?
We're a separate entity under the umbrella of Henry Ford, so we utilize Henry Ford services, but we are our own nonprofit agency.
Okay, and then how many people are in the program that you just?
Just over 1,400.
Okay, in the centers that you mentioned already?
Yes.
Okay.
Yep. Just over 1,400. The new center in Detroit will accommodate 400. Most of our centers will accommodate between 250 and 350, depending on the size of the center.
And then how many employees do you have?
You know, that I'm not sure.
Oh.
Good question. I've never been asked that one before, but I will find out.
I was thinking staff ratio to the people that are coming.
So we staff with our own staff, not agency staff. So I don't really know the ratio because we have the whole interdisciplinary team as well as home care and housekeeping staff. So that is not something I've been asked before. I apologize.
If a patient needs medical attention and nursing care, say 3 times a day, morning, afternoon, evening, does this system provide for that?
You know, we look at everybody individually. As long as they don't require 24-hour care, we can be a good option for them. If they're living in an independent situation where they may have an on-site provider, we sometimes will contract with those individuals to help provide that supportive staffing. But we do have people that do have individuals that are coming in multiple times a day, and we are kind of task-oriented, so we're not like a sitter service, but we will go in and provide laundry, housekeeping, personal care, and then we would do the task, and then we would leave.
More like a nurse, though. For example, my wife, she had peritoneal dialysis 3 times a day.
Okay.
But I mean, that's hard for somebody to come in the morning and
Right. Right. So currently, we're not doing peritoneal dialysis. That is something that we're looking towards doing in the future. But like I know there's an individual right now where they need to have their blood sugars checked 3 times a day, and they're living in an independent living community. So we are contracting with their staff to go in and do things 3 times a day. So we can try to look and try to be as creative as possible to keep them in their own home, and that would be part of the nurse and social worker assessment upon enrolling into the program.
got another
Carol?
question. So on the 20, what is it, about 2,400 a month?
For
not-
income, their
Yeah.
income needs to be less than $2,523 per month individually. So they don't look at the household income, it's per person. So if the husband makes $3,000 and the wife makes $2,000, she can join the program, but he would not qualify for PACE Medicaid. He would have to pay privately.
So they're not taking the 25-23 and paying for lunches or any of these services? That's,
When someone's in the program, everything is covered 100%.
okay.
Dental, vision, podiatry, audiology, medications, equipment, home care, everything we provide. There will be no out-of-pocket costs for people in the program at all if they're in PACE, and they no longer need any other insurance either. So if they're paying co-pays, deductibles, premiums, all of that would no longer be something they would be responsible for when they're in the PACE program.
So it would, if they're on Medicaid, would that be one of the sources of income?
So Medicaid would pay us to provide the services for the person.
Okay.
So they don't have to pay anything out of pocket, and they would keep their own Social Security. And we would provide those services as long as they're income asset qualified. So income less than $25,23, assets less than $2,000.
Okay.
Liquidable assets, checking, savings, cash value of life insurance, and those things.
Marcia?
Do you have very many self-paying individuals?
No. I think right now we might have 2. So sometimes people will pay privately for a month or 2 to spend down in order to qualify for the program. But most of our aging population in our program are those that are low income.
I just have another question. I'm
question?
confused about the finances.
Okay.
You say that, and they don't have income over 2,000, assets not over 2,000. They're living in their own homes.
So they can keep a home and they can keep a car, but it's anything else that they look at
Okay.
for
So
Medicaid
it's
criteria.
Plus car and home.
Yeah, so they don't
Okay.
count that in their assets.
Okay.
It's anything like checking, savings, IRA, annuities,
Okay.
cash value of life insurance. So sometimes if people have a little bit of money, they might take some and do a prepaid funeral, add a ramp on their home, do some modifications to spend the money down. There's things that they can do legally to qualify for Medicaid. So I always recommend that they talk to an elder law attorney because they would be able to give them advice as to how to spend that money down to qualify for Medicaid. Does that answer it now?
Yeah.
Okay, perfect.
Obviously, you must get a number of folks inquiring about the program who don't meet the income or the nursing home, however you said that. I forget how you said that.
Level of care.
That's it. Where do you refer those folks? Or what do you do with those folks?
So we will look at different agencies. We work with those that help with finding placement for people if they're living in their own home and it's maybe no longer safe. We work with referring to some other agencies like Oak Street, Dedicated Seniors. So we all kind of collaborate and work together. The nurse and social worker that does the assessment has a resource list too that they will give to families on different home care agencies or whatever they think is the best fit. So once we get into the home to do that complimentary home visit, then we can try to give them other resources. We work very closely with Area Agency on Aging. They refer to us, we refer to them, because we want to find the perfect situation for the aging older adult, whatever makes the best sense for them. So if it's not PACE, what can we do to try to partner them with other agencies?
Okay, we hope that includes the Macomb County Senior Services.
We
as
work
well.
very closely with them. They refer to us and we refer to them, absolutely. We have a very close relationship.
Great, very interesting. If people want more information about your program,
So everyone has a brochure there, the 855 number. My business card is stapled too, so you have my cell phone. Happy to talk with anyone that might know someone that would benefit from PACE, please feel free to give them our contact information. We have a great website with the videos, testimonials, great information. So I often, when I'm talking to people, ask them to look at that too, because there's lots of information available.
All right. If there are no other questions, oh, one more question down here. Vito.
You know, it sounds like a great program, and you said it's all word of mouth. Is there any other way to get the program out to a lot of these senior citizens that live across Macomb County?
So we have done a little bit of advertising on TV. You know, really the biggest advertisement that I have are those moving billboards out there. We have about 150 buses on the road getting people where they need to go. So a lot of people will mention that they've seen our buses. It's a lot of networking. We go to a lot of meetings and try to collaborate with other area professionals. But that's kind of where we're at right now as to how we share the information about PACE in the community.
But you also said that like the social workers, caseworkers, doctor's office, they all have that information. So if they know of a patient that needs help, they're going to refer them right away.
Yeah, they do. They're probably one of our top 5 referral sources are those social workers in medical situations where they know someone's going home and that they would benefit from having some resources to help them, because the hospitals don't want people bouncing back, you know, in and out of the hospitals, as well as the rehab center. So yes, they use us quite often.
Okay, one more. And I've debated whether to say anything, whether I'm speaking out of turn or not, but I belong to a networking group, SCAN, and we are meeting, I think, in September or November at your East Point location.
Actually, I think it's Sterling Heights.
Oh, the Sterling Heights,
yep.
Yeah. And I don't know if, that's a networking group that anybody can join, but others can visit in one of those groups. So I don't know if you have the space or, you know, but I think that's Sterling
a
Heights,
great suggestion, absolutely.
that anybody here could go. I'm going to that one.
The third Friday of September, I believe.
Yeah.
I can get that to Adriana, the exact the date of that. But yes, any of you are welcome to come and attend and see the center for yourselves, either at that point or, you know, feel free to call me directly. We're doing tours all the time, and I can make sure to meet you at the center and show you the location. So the two in Macomb County, the Sterling Heights is at 15.5 and Mound. It's behind the big Liberty Bell if you're familiar with Mound and 15 Mile. And then the other one is in East Point at 10 Mile and Gratiot.
Great. Yeah, Adriana, if you can send that out to everybody,
yeah,
it would be great.
Thank you. I will get that
even
to
just
you.
to participate in a networking opportunity with other groups would be great. All right. Well, thank you so much for coming.
Thank you very much.
Very
have a nice day.
informative. I really appreciate it. We had a motion to accept and file this report. We need to vote on it. All those in favor of receiving and filing, say yes.
Yes.
Any opposed? All right. I'm trying to do this in the right order. My instinct is to do it in the other order, but I'm doing it in the correct order this time. And our next presentation is on topic because 2 weeks from now we're voting in a primary election, and not long after that we're voting in a general election. So we've asked the county clerk, Mr. Ferlini, to come and talk about elections. It's a hot topic.
Well, thank you for having me. Again, I'm Anthony Forlini. I'm the Macomb County Clerk, and we do have a very special time coming up. Our elections are coming up, which is kind of interesting because of close to 100 employees that I have, 4 are in elections, but yet it's the thing that people see, probably the biggest thing we have. And so I gave everyone a brochure just so you can see the different locations we have and all the different services we do offer. As you know, we do have a primary just coming up, and many of you may have already voted. You may have gotten your absentee ballot and voted. You still have time, and this primary that's coming up is one that is defined by party, right? So you can only vote for either the Democrat Party or the Republican Party. Some people get frustrated with that. I wanted to vote for, if you're a Republican, I voted Republican, I wanted to vote for Mark Hackle. He's a Democrat. That's not fair. Why, you know, those are the kinds of things we tend to hear. But the winning candidate in each party goes forward to the general. And these primaries are held every even year. Again, you can only vote straight ticket. I think most everyone here knows that. Those that move forward move on to the general election, which is November the 8th. All political parties, not just Democrats and Republicans, are in that race. So we just heard for the governor candidate, there's going to be a U.S. party candidate. So that's another addition for that race. What's interesting about this year, I think, is the Independent Citizens Redistricting Commission that was authorized through a 2018 vote of the people, which, as you know or may not know, every 10 years we go through the census, and depending on the census numbers, we have to redistrict our various seats. And after the 2020 census, the results of the redistricting are now, well, this graph shows you all the different districts. You're not going to be able to tell anything from this one, but the congressional district, which is kind of interesting, is District 10, which was basically north of Hall Road through the Thumb area. You can see it it's pretty darn close to what the 9th district looks like on the left side. So they renamed it the 9th district. The 10th district is now mostly south. I shouldn't say mostly south. They kind of mix things up with these districts. You see the new 10th district goes down through Macomb County, the western side of Hall Road through Rochester Hills. That's the new 10th district, which also includes Harrison Township. The 9th district looks very similar to what the old 10th district looks like, but it's been renamed the 9th district. Here's what's a little bit more interesting is the Senate and the House districts. You can see the two different maps from 2018 and 2022 now. The 2018 map basically kept everybody in Macomb County. 3 of the 4 senators are guaranteed to be a Macomb County resident. There was one that could have been a St. Clair County resident. Under the 2022 maps, it's conceivable that all 7 of the senators could potentially not live in Macomb County. And if you look at the boundaries, if you look at what you have in front of you, you can see they're kind of like ribbons that run through into Wayne County, the 12th, the 10th, I can't see these numbers, but across the board. See, 25 goes up into St. Clair County. I can't see the numbers, but you can see where Macomb County is in the blue and how all of these, Macomb County is basically split up into other counties also. So it's very conceivable that the 3rd largest county in the state may not even have a senator that lives in their community. The state rep seats, very similar. There was, by the way, there was 4 state senators before. Now there's 7 that potentially could live in Macomb or a combination of places. If we look at the state representative districts, it went from potentially 10 to 14, 9 of which could be outside of our county. So I think I don't know if anyone thought that through or how that affected Macomb County, but that's what we have. And you can just see how, I look at my old district, which was 24, but it's now 62, and where originally it was Harrison Township, St. Clair Shores. Then I got redistricted back in 2018 to be Harrison Township, and you can see on the 2018 map it was Harrison Township. It swung around Mount Clemens into Clinton Township and up into Macomb Township. Now, I can tell you that's probably a district that, the way it's written, was reason why people said we should probably have some independent commission do this, right? It's just kind of the way it was drawn up. However, I can tell you, when I look at the new map, people can make that same argument, right?
Was there no one on the commission from Macomb County?
Good question. I don't know.
Seems
I don't know.
really awful.
It's just, and I'm saying it actually could be better if everyone was from Macomb County. Our influences is going to go into Wayne, it's going to go into Oakland, it's going to go into St. Clair. So it could go the other way. So I'm not saying it's necessarily bad. I'm just saying a reality, okay, of what potentially could happen. I think it's imperative that Macomb County put good candidates up, right, that get elected. So anyhow, but where I was swung, I used to be Harrison, St. Clair Shores, then it was Harrison, Macomb Township, Clinton Township, parts of those two. Now that same district is Harrison, a part of Chesterfield, a part of Roseville, a part of Fraser, a part of St. Clair Shores. And I'm not sure the logic behind it, The breakdown, Republican, Democrat, seem to be, it doesn't change it too much. It looks fairly similar. So that's just how the map was drawn up. And then the Macomb County Commissioner districts. These here, mostly stayed very similar to what it was. The 2022 map and the 2018 map. Again, I'll look at mine that I'm most familiar with, which is Harrison Township, St. Clair Shores. That was pretty much the way it was before, except there was a part that was East Point kind of swung around into a part of St. Clair Shores. Both were good maps, but they're different maps, right? So, register to vote. I hope everybody here is registered to vote, and I hope everyone does vote. And the interesting thing is you can register to vote all the way through Election Day. So if you haven't done it, please don't wait until Election Day. Try to get it done before that. These clerks at the local bases, our elections are held in the local communities. We are not the ones that administer it. Often you've heard in the media with a lot of the things that have been going on for the last year and a half about elections. Some states run the elections, some counties run the elections. Very few, I don't know how many, couple, two, three, two states? We're one of two states that run it locally. The local clerks run the elections. And so I'll tell you, over the past year, I've had people beating their drums outside my office, demanding certain things that I just couldn't deliver. They had to really go all the way across the county and beat the drums at all the local clerks. I didn't encourage that. I just let them come and beat on me a little bit. But absentee voting is really become almost the standard for almost, it's a huge amount of people that are absentee voting. And I think really the state needs to take a hard look at that, how the dynamics have changed, how elections are being handled. Even my own staff, they had come in at 6 a.m. in case there was a problem. I said, "Are you kidding me? You mean we're not administering the local elections?" So now we have, his goal is, are you the one that's going to have the phone? Who's going to have the phone? We haven't decided yet. You haven't decided. I said, one person's going to have a cell phone. Everything's going to be forwarded to that. If there's a problem, then call yourself into action. Don't get up at 6 in the morning, bring the entire staff at 6 in the morning. And really, our show time starts at 10 at night. No human is designed to do that, right? So I've kind of changed it up a little bit. They were a little bit shocked because of 6 in the morning, very little is happening. I don't want everybody shaken up and out there at the office at 6 a.m. if they don't need to be. So, but we need to change things up because the absentee ballots are so large that it wasn't thought about how they were going to count all these ballots in one evening. That's a problem. So I'm gonna stay on the state as far as that and try to get the absentee ballots, really a new system. I think early voting is really a smart thing to do, where you can go in and actually put your ballot into the machine and have it be counted in the local clerk's office. That'll take a lot of the edge off of the absentee ballots. People feel a little bit better because they're putting it into the machine. It's being counted. The machine is locked down and cabled so that it can't be tampered with. The machine won't deliver results, report results, until after the elections are over. I think it's a smart move. I think it's important. I think there should be early voting, my own personal opinion, 2 to 3 weeks beforehand. So if you want to vote, take your time, go down there and vote in person. The system we have is ES&S. So you've heard all the Dominion, I don't know if you've heard all that. You guys have Dominion. No, we don't. And there's nothing against Dominion. I'm just saying we have ES&S machines. So these are the machines. We shut off the video. Basically, you've probably all gone through this. The tabulator takes in the ballots. You vote. If something happens wrong in your markings, the machine will reject it. That's the other great thing about absentee ballots or about voting in person, is because when you put it in and you accidentally voted, if you're a Republican, you voted for Mark Hackle, it'll spit it out because he's not on the Republican side. You need to change your ballot. So that's a good thing about voting in person. It auto-corrects for you. That doesn't correct, but it spits it out so that you can fix your ballot. Or if you overvoted, like these. Yeah, there's a lot of great names in here. Give you a chance, it's a great system. Everything is locked down in here. Everything is numbered so that when they lock it with the cable, when they lock the USB port into the ballot machine, when it's all over, that number has to match, uncut. They cut the USB stick out and they bring it out to the county clerk's office, which is something we've done a little bit different. I'll talk a little bit about it later. You're going to see that the elections results are going to come in later than normal. So you may want to get your rest. Don't sit up because I think it's going to be a while. No more modeming. We stopped modeming. We were the first in the state to stop it. The state has now, I think, are all machines now not being modemed in the state, do you know? Yeah. Oh, it's been decided. When they do upgrades to their machines.
The ones that have not updated or gone through recertification again can still
Yeah.
modem.
So when they go through recertification, they're not going to be allowed to modem anymore. Well, we were the first in the state to do that. So I still think there's value to it. I don't think that there were controls put in place before. We were the ones to expose that there was maybe certain things, protocols that should happen. If those protocols were enacted originally, nobody could have questioned it. A quick example was Verizon was, I wanted the modem data. They says, we were not going to give it to you. I go, what do you mean you're not going to give it to me? I says, we have retention standards. Nobody ever asked for them before. They says they weren't going to give it to us. Well, short of a subpoena, working with our corporate counsel, they finally relented and gave it to us. And, I don't know why they didn't right up front, because it alerted me that there could be a problem. Guess what? There's no problem. They should have given it to us right away. We wouldn't have shut off the modems, but the state has gone forward anyhow. I don't know how to get to the next page here. It's not going. You don't even need that. Okay. Every precinct's got express vote. Just so you know, so if you're handicapped, you don't want a paper ballot. The other thing to note is everyone says that we are, well, this is a video of a guy doing an express vote. You can actually vote on a computer. Okay, there is a paper trail behind it, but there's one per precinct. Give it a try if you want. Just a little bit, I think the biggest question we have is about election security. our elections have, in Macomb County, I can tell you, we have probably some of the best clerks, the best systems in the state. I have all the confidence in the world with everybody that across the county, as well as our own election staff here. And I mentioned a couple things that we did, shut off the modems. We also did something interesting. No, I don't know that anyone or one or two other counties are maybe doing it now, are actually, when you put your ballot in, there's a mechanism in there that'll actually scan the ballot and retain that information. Not just the information, but the actual scan of the ballot. So people say, well, I don't know how do I know my ballot was in there? Well, if you put a little, I shouldn't even suggest this, but a smiley face or something on the page where it's not going to matter, and you went back and looked at it, you'd actually find your ballot in there, because that's the one identifying thing that or if there's some identifier on there that not supposed to do that, by the way, but that's one way of doing it. But we are scanning, so we were one of the first in the state to do that. We're also being involved with training election workers across the state, across the county. That's something new. We know that we need election workers. There's a little bit of a crisis here in getting election workers. And the thing that is important to know is that every single precinct should have one Democrat and one Republican. One Democrat and one Republican. Do you think that is happening across our county or across the state? No. I know it's not. But somebody has to declare themselves a Democrat, somebody has to declare themselves a Republican. I would like to, because we have the diversity across our county, to be able to bring our county together and bring Democrats into Republican areas and Republicans into Democrat areas and try to get that crossbreeding of ideas and know that everyone's keeping a good eye on elections. And that's something that's never been done before. It's not our responsibility, but we're taking it upon ourselves to do it. We've got some great people, Genevieve behind me here, and Gosei and Mike Ricks are all part of that training. You probably heard I've done a forensic audit on our server, which was kind of a big deal. We're the only ones in the state to have done it. And the good news is the audit that we did showed exactly what we thought it would, that there was no outside interference with our server. And again, it was of our server, what we were responsible for. With the modems connected and not knowing and some of the things that were happening in the past, I wanted to make sure that we can confidently say, I can answer the question, that our server was never infiltrated by outside influence. So that's a good thing for us to know. It's a good thing going forward. Our local clerks are now doing hash validations. They're in the process of getting that all ready for November, which means that they test the machine to make sure everything that went in there was certified, and what was out on the back end after the election, nothing changed in between. That's a great thing, and I'll bet the state will follow our lead across the state soon and require everybody to do the same thing, but we're the first to do it. So anyhow, any questions? Anytime you can vote in person, you should. Why not?
Instead of absentee ballots?
No, you can do it either way. What I'm saying, but my comment back then was, by voting in person, you take the pressure off the absentee boards, because they're going to be processing those ballots through the night. It's just, it's a big toll on these people, because they're there first thing in the morning all the way until the last ballot's counted.
Why can't they process absentees as they come in without telling the results?
State law.
State law.
Is that a state law?
Yeah.
Okay. Well,
And part of it is because, obviously we're all humans. Oh man, we got a lot of Trumps for Carol in there.
Yeah.
Maybe Kathy, you should get her people out and get some votes in there, right? I mean, it's human nature.
You've mentioned that the ballots are now scanned. How long is that information kept?
I think it's 22 months.
Yes.
22 months.
Okay.
Of course, if you FOIA it and you keep it forever, right?
That was, I guess, anybody's question. If it's being scanned, how long is it being kept?
You can FOIA that information, you'll have it forever.
Um,
It doesn't tell you who voted or how they voted.
Are there term limits on your job?
No.
Okay.
My other one, state rep, there was.
Yeah. I think that's when we first met you, when you were state rep.
What's that?
You were first state rep when we first met you.
Yeah, that's correct. Yeah, I think, just another commentary, I think that law, which I recall back, I think I voted for, I think it was a little short-sighted and a little bit too short of terms. We're going through a ton of people through the system, and I don't know that it was, the concept is good, the execution of it was poor. What's happened since, and I was on appropriations at the time, doing budgets, and what I noticed was ever since that's happened, the money that is allocated through the state has been centered more and more through Lansing. And it's because the bureaucrats have taken over. And I can give you a ton of examples of what happened in the time I was there, where because of term limits, that institutional knowledge of the people you represent is gone, and you got fresh meat coming in, and they retrain these reps to think a new way. I think it's I think it's too short a time, and there's not enough flexibility in it because the bureaucrats know they can wait you out.
Any other questions? Can you hit your button on your microphone?
It's not
Thank
really a
you.
question, it's just a comment to what you said about spitting out the bad ballots. I have a friend that was so excited, told me she voted on the primaries, and she voted all Democrats, but she said, I broke my vote and I voted for Joe Romano. And I said, well, Joe Romano's not getting your vote.
Right. There you go.
That's right.
That's a reason that early voting and voting in person, particularly in the primary, is good. Because you'll know that your vote counted. If you turn your ballot in and you made that mistake, it doesn't count. The entire ballot doesn't count.
I'm sorry to interrupt, Tony, but we actually can't close the doors. This is an open meeting, so at least one of them needs to stay open.
Just tell them to be quiet out there.
Yeah, oh, I agree. Exactly. It's the Arts Authority. They should,
Oh, they should know better.
Yeah, they should know better. Any other?
Is the state legislature the people that make laws on the drop boxes?
Yes.
Is there any discussion on that right now that you're aware of?
Oh, I think there's a lot of discussion. I think there's a lot of discussion, but there's no agreement. It's not just the legislature that needs to, not just the House, not just the Senate, but also the governor. So all three have to come together as far as the changes, if there should be any. And I think there should be some changes, not just on that topic, but several areas.
But that is part of state law?
State law.
Anything else? I will just say I served on the State Board of Canvassers for 10 years and administered the election law. It is election law. It exists in the Constitution and by statute. But Tony mentioned that we are very localized. Each local clerk runs elections in this state. Tony doesn't have much say about any of it. He can help. He can push best practices. I got plenty of say. It doesn't count, though. Yeah, exactly. He can push best practices. Helping with election worker training is a great idea. We've been stressing that forever because you have to leave it to each of the little local clerks to try to recruit all of their workers for election day. And it's very, very hard. And then to train them and then to run the elections. I mean, there are clerks up north who frankly operate on their kitchen table. It's literally on their kitchen table. You want to register to vote, you go to his house and you sign up that way. So the laws have to apply across the state. But I will point out that in Clinton Township, where I live and represent, the trial run of the machines happens tomorrow night at 6 p.m. Anyone can go. It's open to the public. Watch them put the ballots in. Watch them pull the ballots out. Count them out. When we chose which vendors would provide election equipment in this state a few years ago, we had 3 requirements of any vendor. Number 1, that there be a paper ballot so that we can audit this. If there's a recount, you can count them unless there's a problem with the ballot box. But we have a paper ballot system. People don't think of it because they put it through the scanner. But we have a paper ballot system. Those can all be retrieved out of the machines and counted. Number 2, that our voting machines were not connected to the internet. So despite all you hear, we were transmitting unofficial results, but the machines themselves are not connected to the internet. And third, that they really needed to improve the handicapped accessible machines, which before this last round were sort of a disaster. And if you haven't used them, I really encourage you all to do that when you go to your polling place, if you go in person, because my experience is that sometimes the election workers don't actually know how to use them properly. And having somebody go in and ask to vote on the handicap machine is a good learning experience for everybody.
Yeah, it's rarely used.
It's rarely used, but it's really important if you have a physical disability in particular. And we have not worked out all the bugs. If you are visually impaired, you still require someone to be there. So your vote is in fact not secret because someone is helping you do that. And we need that, the next round of improvements need to fix that. So, any other questions for Tony?
Are the cities looking to split the shifts on Election Day? I think a couple cities tried that.
Yeah, I'm not sure. I can't answer that. I don't know what they're doing, but it goes against just the human body to be that early and then that late and then early again the next day. It's really it's a long process. And when you talk about mistakes happen, we're all human. Mistakes happen, but when you're tired, you're more susceptible to error. So we really need to. The legislature needs to, and I plan on taking a more active role this next year because I do know many of them still. And say, just get some common sense here, guys. We need to take a look at some of this, and people are voting different than they used to. So let's take a hard look, and I'm hoping to have some success with that. I just want to roll back just the comment made that people take the comment that you made and say it cannot be on the internet, but there's an internet chip in there, right? What that is a cell phone chip that goes just one way. It goes out, and it's a zero tunnel, very secure chip that goes out and transmits the data to the county clerk's office, and so it does through cellular networks transmits the data. So it's not like a Wi-Fi. People think of Wi-Fi or this computer, things that are hooked up that way. It's not. It's a zero tunnel cellular chip that sends it out. The problem is that I see with it was the machines were designed that cellular phone, we'll call it. It's not a phone, but it's a chip that transmits. Turns on when the machine turns on in the morning. It doesn't transmit. That's what we were looking for, to see if there's any transmissions during the day. But I think that leads to some potential vulnerability. It'd be really tough to do, but the Hart is another machine maker that their machine doesn't work that way. It only turns on when everything is done, the polls are closed, they turn it on and it transmits. And that's the only one that was really certified through ESA, is it? ES?
The federal group that certifies.
I always get the acronym
equipment.
wrong.
Yeah, I know.
But
me too.
they certified Hart, but they didn't certify the other two. The state certified the other two, so that goes, little tidbits of information I learned.
Okay, any other questions? If not, thank you very much, Mr. Clerk, for coming.
I appreciate seeing everyone's face again, and if you ever need me back, let me know. I'd be happy to give you any new updates. All right?
All right, thank you.
I can give you the election results sometime in November.
Yeah, so. That's good. That's good. Well, I hope you give some in August, too, but yeah. All right, we had a motion to receive and file the clerk's report.
I'll make a motion.
No, we have a motion, now we need to vote. All those in favor say yes? Yes. Any opposed? All right. I know, see, it's not logical this way, I'm sorry. All right, number 8, discussion items. 8A was a review of the recreational activity inventory update that we talked about last time. Now, I will confess, I am confused about why this is on the agenda again, and someone could remind me. We talked about the fact that we had that inventory last time, but it was way out of date, and we weren't sure how useful it was and how we were going to keep it updated. And then I think I gave everybody assignments to go home and figure out what your organizations, if there was any gap in services or things that were special. And I don't think any of us did that, my hunch is, and I don't remember what we were going to do with it. So we're just going to pretend this agenda item is just going to go away. That's what I think.
I so move.
Thank you. Just because it had no, we discussed last time that it didn't have any use, and I didn't catch it when Adriana showed me the proposed agenda going forward. So I don't know how we can officially dismiss the agenda item, but we're going to pretend it's not there. So the next item, 8B, the trip to the DIA. You have a sheet on your desk about the proposed trip. We talked about down to the DIA. We have organized it. It is Tuesday, August 23rd, so near the end of August. We're meeting in the lobby downstairs. We have a bus to take us to the DIA. We have a tour. You have another hour to sort of look at around yourself, and we depart the DIA at 3, and we will be back. We do need RSVPs, but one of the things that we were hoping with this trip that we discussed is that you would find someone in one of the organizations you're involved with who may need a little to feel comfortable organizing one of these trips for their group. So we're hoping you'll each bring somebody with you. Someone who might not have thought about organizing this sort of field trip for their organization. It could be a veterans group, it could be a social service group, it could be a recreation group. Most of the official senior centers do know about this and have organized trips about this. But if there's some other community groups, if there's a large church that hasn't really, isn't aware that this service is available through the DIA, this might be a good chance to go with them to the DIA and show them they can see in a sort of friendly atmosphere what it's about, and maybe they'll go home and organize their own trip for their own group. So that's the plan. But we do need RSVPs to make sure that we have appropriate transportation and a guide and that sort of thing. So I encourage you to come. I'll be there. I think I responded yes today when you sent me the thing. So I need a motion to receive and file this. Okay, Marcia and Barbara. Any further discussion? Questions? If not, all those in favor say aye. Aye. Any opposed? Okay. Item 9 on the agenda is the second avenue for public participation. This is the opportunity for public participation for those who wish to speak for a minimum of or maximum of 3 minutes on any issue at all. Come forward and state your name, please.
I'm Paul Smith. I guess this is a little bit impromptu. It's too bad Mr. Forlini came and spoke and didn't stick around long enough to hear comments on his comments. But he mentioned that the state senate districts especially have been re-gerrymandered so that they cross county lines more than they used to. And my state senate district, District 10, is Sterling Heights, Centerline, Warren, and about 25% of Detroit. So you can rest assured that Macomb County is safe. We've got one candidate from Sterling Heights and 2 from Warren. So Macomb County will be represented in District 10 one way or the other. There's a mention on the gerrymandering committee, why wasn't Macomb County represented? Well, I think there was either 11 or 13 members on the committee and 83 counties. So every county wasn't going to be represented. The business of counting absentee ballots. I've been an election examiner many times. I worked at the polls, different cities and townships, and I've worked as a absentee ballot counter. And you know, it's a 13-hour day at the polls, but it's not a hard day. You go 30, 40 minutes with nobody there. There's this talk of long lines. Well, I haven't seen a line yet. We've had long waits for a voter, but, you know, when you have 6 people taking 13 hours to process 120 votes, it's a long day, but it's not a hard day. We did an election in Shelby Township, and 90% of the workers were at the polls, and 10% of the workers were in the absentee ballot counting area. And we worked from 8 a.m. to 4 p.m., and we did 60% of the work. We had 10% of the people did 60% of the work. I guess I've tried to analyze why that is, because we're just working with papers, not with people. And working with people takes time, but working with a stack of papers doesn't take all that much time. And it's really, really critical to election security that no envelopes get opened before the polls open. They've stretched this election out now. Now the election is 5 weeks long with early voting. So over the night, over the weekend, there's papers around, and nobody knows who's messing with the papers. They talk about the Dominion machines, but what about baskets of paperwork that's sitting there Saturday and Sunday and overnight? So at least with our system, we got postal baskets delivered to teams by precincts, and the clerk had sorted out the envelopes and verified the registration and had them in a box by precinct. And we ran through a slitting machine in front of witnesses and dumped the ballots out of the envelopes, flattened them up, and rammed through the machine. And I think that was a secure process because you had 30 or 40 people in the room. And the fallacy that people are made to believe is that absentee counting is just as much work as live voting. But it's not, because it takes 10 to 15 seconds to run a ballot through a tabulator, but an absentee vote counter can eat up 200 ballots in a minute. It rips through them in no time at all. The other fallacy that I wish Mr. Forlini had been here to listen to is that if you make a mistake, you're out of luck. And that's not really true. That the machine out of 200 ballots would kick out 1 or 2, and then the examiners would converge on it and say, well, what's wrong with this ballot? Is it really a fatal error, or can it be cured? You know, maybe there's 10 issues on the ballot and somebody voted for too many judges, and you can remake a ballot and void out the part that was wrong and still count the ones that are right. So, you know, there's a lot of talk on this. I guess when they said they've extended the voting out from 1 day to 5 weeks. Well, didn't they think that is going to cost money? That instead of hiring people for 1 day, you have to have people work for 5 weeks. That should have been reckoned with. I know Sterling Heights set up an absentee voting center where fundamentally you got 3 people sitting around the rec center doing nothing all day, and once in a while a voter comes in. And in the past, they went to the city clerk's office and pulled somebody off of what they were doing and processed 1 ballot. So I think the absentee, the early voting center is a bit of overkill that could be gotten away with and still have the capability to vote early by walking up to the city or township clerk's office. So thank you very much.
Thank you. Any other public comments? Once, twice, 3 times closing public comments. Now we're on to agenda item number 10, comments from members. Anybody have anything they wish to share? Marsha always has something to share.
Yeah, very quickly, because I had mentioned a networking group called SCAN, and when we come in August, or we don't come in August,
right.
So we probably won't be meeting before that, but the SCAN is a networking group that I would highly recommend if anybody wants to join. It's $35 a year, and they meet bi-monthly, every other month, 3rd Friday morning, 9 until 10:30, and there's usually breakfast served, and the group moves around to different localities. So the one will be at PACE, the PACE office. The one in Sterling Heights in September. If anybody's interested in going, you can go as a guest even without joining. So give me a buzz if you want to go. I will be planning to attend on that. But if anybody's more interested in just having a networking group to hang out with, it's really worthwhile. So thank you.
Do you know what the acronym stands for?
Yes, Senior Coordinating Action Network. And this is in Macomb County. There's also a Wayne County branch and an Oakland County branch.
Great, thank you. Anyone else have any comments? Anything they want to share? If not, we will not be meeting in August. We have the DIA trip, but we will be meeting in September. And hopefully we'll be back to a fuller contingent in September. All right, I would entertain a motion to adjourn. Barbara? Support. Rochelle? I can't hardly see from here. It's like the angle is wrong here. All right, it's been moved and supported to adjourn. All those in favor say aye. Aye. Any opposed? All right. See you all hopefully in August on the bus to the DIA. Thank you very much for coming.